Well, thank you all for calling in. Just maybe to start, you probably heard in the last few minutes the governor's latest decision to close bar.
With the RBJ. Has
Oh,
joined the conference.
okay, I think we're all on now. Anyway, you probably heard in the last few minutes the governor's decision starting at 8 p.m. tonight to close bars, restaurants, gathering places, gyms, fitness centers. Close, takeout, and delivery are going to be approved. But the point is, we are in uncharted territory, and we can expect almost every day there's going to be some very strategic, very proactive decisions being made, and this is no surprise to us. So we just had a little press briefing downstairs. There's a lot I can say. I thought I'd maybe hold off and maybe answer any of your questions first and make sure we cover everything.
I'll say it then. I'm just wondering, do you have any sense of just the potential impact on both employers and employees? And can you speak a little bit to how we're going to look on the other side of this? Your concern?
Brian, there's great concern. There's going to be widespread economic impact. And a point I've been making is when you look at Rochester and the things we'll go through, in the larger picture, look at the cancellation of March Madness, Major League Baseball, the NBA, hockey, all the changes going around nationally right now. The economic impact nationally will be in the billions. We're going to have it here, but I do think if we really make some smart strategic decisions now and anticipate, it's going to get worse. We're going to have more decisions being made coming down from Governor Cuomo and his team. More being made locally from our county executive and our county health director. And just going back to some of the things we've heard so far. To employers, we're encouraging people to be prepared to go remote. We are already at the chamber. A chunk of our employees are already working remotely. We can go 100% remote at any time. We are doing that. We have canceled all meetings. We are doing everything remotely via telephone or video conference. Until further notice, we are limiting access to our office. Our office is open, but you have to come in by appointment, and there's certain things we have visitors go through when they do come in. And it's hard to anticipate the business impacts. Clearly, bars and restaurants, there's going to be an impact, but the takeout and delivery, I thought, was a good decision to keep that going. That does keep some business going. It also keeps a supply of food going, which is important. A couple things that we're asking. I have a letter going out to our legislative leaders today in Albany. It is a time for a pragmatic budget, not one that's idealistic. I think we have to look at ways to limit the impacts on businesses so they can take care of their employees. I do believe in paid sick leave. I believe in paid family leave. But there has to be a corresponding support system for businesses, especially the small ones, who, when this happens, there's an impact. So it really is about listening to all sides, making very smart, thoughtful decisions. I think the whole issue of social distancing, the steps Governor Cuomo has taken so far have been thoughtful and proactive, and we support them, as well as the county exec and Dr. Mendoza, what they are doing locally. It's hard to gauge what that impact will be, but it will be profound by the time we're done because, let's face it, folks, it is going to get far worse before it gets better. This is just the beginning.
Hi, this is Diana Carter from the Rochester Business Journal. You've reiterated what many people have said about working from home, working remotely, but that kind of presumes you work at a desk. What about all the people in the service industry or people in manufacturing? Any suggestion for how employees and employers are going to deal with not being able to perform that kind of work?
That's a great question. I think for manufacturing entities, leaders taking whatever steps they can. First of all, the distancing, as we've heard, is critical. Encouraging employees who are sick do not come to work. Those who may have had some exposure, reinforcing good hygiene habits for everybody in those environments. They have not been closed down yet. We hope they don't close down, but I think we have to be prepared for a number of very difficult decisions coming up in the future. service industry is going to be impacted. Tourism, hotels, obviously the bars and restaurants, which we mentioned before, that is going to happen. I fear layoffs, and I also fear that Rochester, with a very large population living at or below the level of poverty, those people will be the most heavily impacted. And I think if government limits the impact on businesses, hopefully businesses will hang on and not have to lay off employees unless absolutely necessary, and really help them through these very, very tough times. At the Chamber, not only are we having a remote work opportunity, we have invited parents here, bring your kids to work if you'd like, save childcare costs. We want to make sure that I've assured all of our employees, which is just under 50, nobody is being laid off. Nobody, if they're sick or not, I don't care what their current contract structure is for work, we are taking care of everybody here until this is over. And maybe not every business can do that, but taking smart strategic steps, and I think this is where government comes in and helps. We were advised a little while ago by County Executive Bellow's office. They're going to offer either no or very low interest loans for businesses. I think everybody's looking how to relax standards, and with the state budget looming, with that budget gap, what we are hoping for is that it is a very much a pragmatic budget, and not putting things into play that will further impact business or families at this point, and trying to just understand these are, again, very difficult, very uncharted times for us, and we have not been through something like this. And as I said before, we can expect 2, 3, 4 months of some impact, and then after that ends, I think there's going to be a corresponding impact with how we do business afterwards. So, Diana, going back to your question, it is not a one-size-fits-all for everybody, but if our leaders just make every decision they can that works for them by keeping their employees and their customers safe and healthy, that's a great step forward. If we slow the spread, we lessen the impact, and that's the whole point of these steps our government leaders are taking right now, is to slow that spread.
Bob, how is Rochester Chamber informing employers to make informed decisions like you were just to follow up on that?
One thing Dan asked a question, I'll pass on. If you check our website, and I'm very proud of our communications team, Dan Smith has led this, every bit of information we get out. We're members of the U.S. Chamber of Commerce, member of the Association of Chamber of Commerce Executives. We're checking with CDC, Johns Hopkins, New York State, the county. We are on websites. We're in personal contact with the governor's office and the county exec's office almost every day. And we're putting that information out on our website and on Twitter as well. If you follow me and us on Twitter, we try and put things out, not to overload people, not to panic them, but to provide as much information as we can as we get it. And that landscape is changing hourly. So, and I want to applaud the media. I've heard some people complaining about the media creating panic. The media is not creating panic. The media, I think, is doing a great job communicating those facts as they come out, as quickly as they come out. They're doing a service like our government leaders are doing. So I think the more we get the information out, the better. And if I could offer one thing, if we could just take a step back and not panic. If you're going to go shopping, shop for a week. You don't shop for toilet paper for next 3 months. Or soap or soup. Shop for a week. The Wegmans, the Tops, the supermarkets, they will keep things stocked. They're doing a great job. But when lines are out the door at 6 a.m. and people are hoarding things, that creates the panic and the supply issue. So just take a step back. We've been assured the supply is not going to stop. So just doing your weekly shopping and doing it strategically will hopefully slow this down. And I think we say that to our neighbors, our friends, our businesses, and we help each other any way that we can. We share, we help. There's a sense of community. And for those that don't have access to transportation or finances, I think they're in a much worse position. So we have to do much more to help those people. And part of that is just listening and following through.
Bob, it's Velvet with the RBJ. I'm curious what you would say about nonprofits that serve individuals in poverty, that maybe serve the elderly, and obviously they can't work from home. What are your thoughts on that?
Like I would say, Velvet, just like our first responders and our healthcare professionals, if you have to go out and deal directly with with customers and clients, which many do, just take precautions. I think the hygiene precautions are important. I watched in 60 Minutes last night where the governor was featured. You watched the nurses from Westchester County, how they really put garb on and protective equipment, masks and what have you, if they're going to go in and deal directly with people. We have to protect those providers, our first responders, our healthcare professionals, our nurses, our doctors. Especially, we have social workers who go out and are going to families. Their work is necessary. We have to make sure they are protected. If they can't do it remotely, they must at least be protected because they have to be kept safe and healthy. If they go out and contract the disease, it just really exacerbates the situation. So I just would apply every common sense principle that we can. And I'm listening to state and local officials. They are trying to make available that level of equipment for things that people that need it have it. And for those that don't need it, don't get it. So for those that do need it, have it available. Much like other supplies and things that we are trying to make sure we tell people, don't hoard, don't panic. You don't need a test if you have no symptoms. If you have symptoms and you're in the risk group, yes, you need a test. But going just as a precaution with no symptoms whatsoever, do not bog this system down. Our healthcare systems are keeping their heads above water, but as I've talked to both systems, they'll be challenged if this epidemic grows exponentially. I mean, we're getting off the flu season, kind of coming to an end, but the availability of beds and equipment and ventilators and all that, we're being challenged by that. So these other decisions are important, and I guess maybe I can't give any absolute answer to every eventuality, but if leaders in not-for-profits and business took smart strategic decisions, applied common sense, protect your workers and employees, and whatever those steps might be, I think we'll be far better off. Anybody else?
Just wondering, we've had a number of places, the restaurant is one of those things, closed, but keep the employees coming to work. Some of the colleges closed, but keep the employees coming to work. Do you think these places, you had said that the restaurants you thought was a good job. I'm just wondering, we're still having people come in, commingle, work together, all that. Is that concerning at all, that we need to move to take another step, or you think that's the way we should be going, keeping people working, not the public coming in?
Brian, I believe for restaurants, I would defer to restaurant owners and managers that if they're producing food for takeout, whatever they would need at that time, taking precautions. Most restaurants wear caps, gloves, probably a mask or mouth covering would be important as well to protect them. It might not apply to every one of their employees, but I think for the most part, if they're doing takeout work, that's going to happen. That kind of work can't be done remotely. It has to be done. The governor is relaxing the unemployment rules for people that go on unemployment. I think everybody's trying to pitch in and help with this. But the fear we have is there's going to be layoffs and jobs cut. And that's why I think if everybody takes a step back, we don't add more burdens on business, which they can't keep up with. If we mandate certain things that will cause businesses to close down, we exacerbate it. And I think it's just common sense. And what I'm seeing so far is common sense oriented. And with the issue of sick leave, which is going to be prominent, I'm sure, in this year's budget, most companies provide that now. Most companies are providing that to their employees. For those that don't and are going to be mandated at some point, having a corresponding aid package for them so they are not, in many ways, impacted negatively and are forced to lay off or reduce jobs.
Is there other things when you're talking about don't mandate things? You have a checklist of things you want government to avoid?
Well, I think right now there's nothing we could ever tell government to avoid because these decisions will come every day. What I'm telling people is nothing is off the table right now. What you think would never happen may happen next week. We don't know. The issue of a national quarantine, I've heard different renditions of that. I'm not sure if that will happen. But I certainly would not dismiss it as fake news or not happening because we're in the midst of this epidemic. It is a pandemic. The good thing is you're seeing China start to come out of it. So there is light at the end of the tunnel, but I do fear we're probably 2 or 3 months at the minimum away from getting to that point. So how we act between now and then is going to be an imperative as to how we come out of it. So be it far from me to say what's off the list. I can't say that. What I can do is try to make sure that the views of our business leaders are heard by decision makers. And then when those decisions are made, look for ways to help how those are implemented and really try and help people, because the impact is widespread. Events are being canceled everywhere, as you mentioned, bars, restaurants, the hotel and service industry, travel. All these are going to be taking huge hits, and I'm sure those companies can't take care of everybody. So there's going to be a widespread impact. I almost think that we should look at creating a new community-wide fund to help people through these times and pull together, because I go back to the people most impacted are those that are being impacted right now by poverty or low economic opportunities. It'll get worse for them, the ones that don't have access to the kind of health care that others have. So I just think we have to look at this strategically, and perhaps all the agencies can pull together, and I'm not sure where that should rest, but I think we should look at a way to help supplement what businesses and families are and will go through over the next 2 or 3 months. We can wrap it up. There's nothing else. We're going to obviously pay very close attention to all the announcements that do come out. We're going to communicate that. If anyone in the media has information that you want to share, get out, please let us know. We have a pretty wide network here, and you'll see from our website and Twitter accounts and all that, you can kind of follow what we're doing. We're trying to stay on top of this. I cannot predict the future, but I just think that what is being done right now, I can't argue with any of these decisions. I think they're absolutely necessary, as difficult as they may be. And the worst thing we could have now is vacillation and weak leadership. People that wait and vacillate, are afraid to make a tough decision, are only going to make this worse. That's why I applaud the governor, the county executive, the health commissioner here. They're making some very difficult but very necessary decisions, and we are far better off because of it. And I do think that even with the cases growing every day, hopefully we'll slow down the spread. And people should not flaunt this, should not go gathering. These rules are being put in place for a reason. We have to deal with it. And hopefully we'll be able to get through the economic impacts. But not one of us here listening to this, or anybody in this area, nobody is going to go unscathed with this one. We are all going to take some pretty big hits economically, from individual 401k accounts to businesses to unemployment to jobs. But if we pull together and hopefully minimize this, we'll try and keep those numbers as small as we can and help those people affected. And it's no time to raise everybody's personal political views on this either. I think this is where Democrats, Republicans, everybody, you pull together. You're public servants. You serve others. We don't want to hear about what your agenda is for the next couple of weeks. We want to hear how you help people get through this. And I do think the governor and president, they've been in contact. They've praised each other. We've seen it across the board. We need more of that at this time. Even though we're in an election year, put politics to the side, put public service out front, and we're going to get through this. We're tough. We're used to this stuff in many ways. We've been through some things before, maybe not like this, but I'm confident if we all pitch in and help and we minimize the impact, we're going to be okay. And so I would encourage that on behalf of everybody.